So in your practice, a big part of your patients are coming to you to take care of their arthritic pain.
Correct.
So what do you do?
Well, it depends on the type of patient, right, and what the patient's interested in pursuing. So, and what their end goal is. Do they want to get back to playing golf, or they just want to be able to walk in the grocery store better?
Okay.
So you've got a wide variety of patients here. So, and it depends on where the arthritis is.
So let's say knees.
Knees, okay. So, in a patient who has knee pain and there's osteoarthritis, I mean, you've got several options. And the ones I would steer you away from are steroid injections, okay, because sometimes that's all we have, because the insurance company says you've got to fail that before I can do the next thing.
Okay.
But so that accepted. My recommendation is you have viscosupplementation. That would be basically putting the same type of lubricant that's naturally found in your knee. We put that back in there, and you can have that done about every 6 months.
Okay.
So that's an easy way to deal with it. I'd say a non-reimbursed, meaning an experimental therapy that we've talked about before, would be regenerative treatments in the knee.
Like injecting
regenerative proteins and,
okay.
and
like growth factors, what
yes.
the public calls stem cells treatment into the area.
Yes. But as we've talked about before, I think stem cell therapy is deceptive. We're really using growth factors.
Okay. And that's been effective.
Very effective.
That's cash out of pocket. I know the prices. It's not that expensive, especially if it works.
Correct. Yeah. For something like a knee, you're using very few cc's, usually a couple of cc's in the knee, and it's not very expensive. It's a heck of a lot less than having a knee replacement.
Okay. Now, arthritis, like in the back.
Yes.
And other areas of the body.
Same thing? Same thing as a knee. Unfortunately, I can't use viscosupplementation in the spine. It's not, I could, but Medicare and all the insurance companies won't pay for it. It's really limited to just the knee.
Okay.
They won't let me use it in the hips or shoulders, even though we've done it off label and we know it works, but it's not something that insurance companies will pay for. So arthritis of the spine and the facet joints. You know, one of the probably the most common thing that I do that is a covered procedure is I go and do some test blocks, make sure that the facet joint is the pain generator, and then I can do an ablation where I put a needle on that little sensory nerve, heat it up and destroy it. That's one way to deal with
Okay.
it. Another way would be regenerative treatments. You can go in and put these growth factors in the damaged joint, because those joints are just...
And they're injected in there?
Yes.
Under scope? I mean, you're doing this?
Everything I do is under x-ray.
Under
or
x-ray, okay.
some type of imaging, ultrasound or x-ray. But those joints, they have a synovial lining just like your knee, and they wear out over time. And so we can use many of the same treatments in the spine that we use in knees and hips and fingers. And
so the results have been pretty good for people with arthritic pain?
Very good. You know, like I said before, regenerative medicine doesn't work for everyone. But those patients that it does work for, which is way over 50%, it is life-changing.
Now, is this true that many of these centers that are doing a bunch of injection therapy, they don't even do it under x-ray?
You know, that used to be the case.
Doing it?
Well, I think they are using x-ray because that's the standard of care and you can't get reimbursed. I think a lot of physicians don't do different views, which I do on all of my procedures to make sure I am in where I say I am and not someplace I shouldn't be.
So it's not just one camera, you're looking at multiple views.
Yes, multiple views, and you need to use contrast to make sure that it's actually distributing the medication exactly where you want it to go and not in a blood vessel or some other structure.